All right, welcome back to Your Hometown with Brett and Sierra. What do people notice in the first 5 seconds of meeting you? Yeah, Sierra's right. It's your smile. And today, Dr. Benjamin Lee, who of course has been in my family many, many years, treating my family, gets to talk about a little bit more than that, TMJ.
Yeah, let me tell you, I think it was so interesting. Brett and I were talking to you off camera. I have a friend who has been dealing with migraines for years, done everything, Botox, you name it, drugs, everything, and nothing's helped. And now I find out that maybe it's more of a dental issue technically than it is a medical one.
It could be. It could be bite related, and bite relationships. You know, everyone lumps occlusal muscular dysfunction and temporomandibular joint dysfunction together and calls it TMJ. Right. You know, the TMJ is actually just the temporomandibular joint, your jaw joint. But occlusal muscular dysfunction is what 99% of these cases are. It's from people that grind their teeth to the point that their muscles are so hyperactive and so stimulated that they spasm and give them tension headaches, but those tension headaches can mimic migraines. Yeah. And you go to a physician, there's a few physicians that know what to look for, but most of them will just put you on migraine medication.
And Doc Ben, one of the things I've seen with your patient base over the years are these night guards, are these universe. Let's expand a little bit more about what those are and how they're custom fit, just a bit.
Yeah, night guards are custom made for each patient there because each night guard has to be made for your bite because it's adjusted to give you a perfect bite, which kind of fools your body into thinking everything's ideal in your mouth, at which point the muscles will begin to relax. The condyles, or the little balls at the top of the mandible or jawbone, seat into the joint, and once those condyles are seated, everything will stay nice and relaxed. Wow.
You know, one of the things, and you brought up, because people noticed your smile first, cosmetic dentistry and full mouth reconstruction. It is amazing the difference you can make with these procedures. Talk a little bit about, I know you have one patient that's coming in now that you're going to make a huge difference.
Oh, it's life-changing, and it'll definitely change her life because she's in pain all the time. Yeah. And so and this would be her. So you can see when you look at this how overlapped, what an overbite she has because she's lost all her vertical dimension. Okay. She's worn her teeth down over the years to just pretty much nothing. Right. Vertical dimension is just an arbitrary measurement between your upper and lower jaws. You know, maximum vertical dimension is a 16-year-old when all their teeth first come in. Zero vertical dimension is a denture wearer with their teeth out and they're ridge to ridge. But we're all somewhere in between there as we age. Yeah. I tell you,
we take a look at some before and after pictures that come up on this one. Now Dr. Ben has exactly, check this out, Sierra. This is what this young lady is going to look like when she walks out in about a month from right now, Doc Ben?
Yeah, well, it takes us about a month to do the cosmetic wax up. This is a diagnostic process. We do this to diagnose her case. When we actually do a full mouth reconstruction, it's about a year-long process. Okay. Because we'll come in, we make laboratory processed acrylic provisionals. And so from that to this is really a matter of 2 days, but she'll be in provisionals. But even in the provisionals, they have the look that they want and they function properly. Huh. But over that period of about the next 6 months, we'll be working her bite out on those provisionals to make sure everything is perfect. And then we allow her to stay in those provisionals and let her muscles adapt to that new bite. Then we slowly move them into porcelain, a sextant at a time. Yeah. So how is her bite going to look then when you're finished?
Check this out, Sierra.
This is her diagnostic process. This is her diagnostic wax up. This is where she'll be when we're done.
That's totally different.
Amazing, isn't it though? Really amazing. Ben, you said your staff almost going on 30 years of doing stuff like this, recon and stuff. Am I correct?
I've been doing it 30 years. But but this lady, you know, she'll have perfect function. The second, you know, that's always the primary objective we're going for. The secondary byproduct, if you will, is cosmetic, is aesthetics. Sure. So she'll look amazing, but the main thing is she'll function so well.
So if we have an issue, do we just call up, or maybe we don't know we have an issue? If we come in, you can tell us we have one.
Yeah, we check that on every initial exam because most people don't know they even have a problem. You know, your bite pressure during the day is about 165 pounds. At nighttime, when all your protective mechanisms go away, it can get up over 1,000 pounds. Wow. I mean, you can cause, you know, that's what stimulates headaches. You can cause ear problems, you know, tinnitus or ringing in the ears, and cracked tooth syndrome. We see people break teeth all the time from their parafunctional habit at nighttime.
Yep, he's been treating my family for 17 years in East Wichita. 685-2309, or they can find you online also, Doc Ben, right?
Yes, sir.
Fantastic. Great to share that. We learned something. A lot. Didn't we, though?
Yes.
All right. We'll be right back.